Hello, I'm Barry Levy. I'm on the faculty of Tufts University School of Medicine, and I welcome you to the satellite session on the role of universities in addressing the impacts of war on health, human rights, and the environment. Today, 6 other speakers and I will make brief presentations and join in discussion with each other and with you about these important issues. At the start, I want to thank Steve Hargarten and the Office of Global Health at the Medical College of Wisconsin for their support. And I'd like to acknowledge Jenna Smith for her assistance and Keith Martin for his ongoing encouragement and support. War has profound impacts on health, human rights, and the environment. Over the past year, war has occurred in more than 40 countries, and about 1/4 of people worldwide live in regions directly affected by war. Most wars in recent years have been civil wars in low and middle income countries. And in most wars, the vast majority of deaths have been among civilians. Recent wars have been characterized by forced displacement, attacks on civilians, and attacks on civilian infrastructure. During war, many civilians are injured and killed because of indiscriminate and targeted attacks with explosive weapons. But evidence suggests that in most wars, more civilians become ill and die as a result of the indirect effects of war. These indirect effects are mainly in the following 5 categories: malnutrition, communicable diseases, exacerbation of chronic non-communicable diseases, maternal and infant disorders, and mental and behavioral disorders. A few words about each. Malnutrition occurs during war and the aftermath of war because of reduced food production, restriction of food import, and all too often food has been used as a weapon by military forces who restrict civilians from having access to food. Communicable diseases occur during war primarily due to 3 factors: unsafe water causing gastrointestinal disorders like cholera, crowding in shelters and other places leading to increased transmission of respiratory diseases like COVID and tuberculosis, and decreased immunizations for such diseases as measles, which is highly contagious and often fatal among children who are not immunized against it. During a war, people with non-communicable diseases like cardiovascular disease, chronic lung disease, and diabetes often suffer exacerbations because they cannot access medical care or cannot access their basic medications. And as a result, people with hypertension without being on their medications develop stroke or heart attacks. People with chronic lung disease have their infections not being adequately treated with antibiotics. And people with diabetes may go in, who are on insulin, without that insulin, may go into diabetic coma. Maternal and infant disorders increase during war because of decreased prenatal care, decreased availability of trained birth attendants, and reduced infant care. And as a result, there are increased complications of pregnancy, more infants born with low birth weight, and higher infant mortality rates. And perhaps the most profound and widespread impacts of war on health are in the category of mental and behavioral disorders. And victims of these disorders are often scarred for the rest of their life in some way. We're talking about increased occurrence of post-traumatic stress disorder, depression, alcohol and drug abuse, and suicide as a result of a number of factors, including physical and sexual trauma, witnessing atrocities, family separation, death of loved ones, and forced displacement, and many other factors. Violations of human rights occur frequently during war, and they're manifested by assaults, including rape and gender-based violence, attacks on hospitals and schools and other parts of civilian infrastructure, deprivation of food, water, shelter, and medical care, deployment of landmines and other banned weapons, and forced displacement. And war has many adverse effects on the environment, including contamination of air, water, and soil, use by military forces, extensive use of fossil fuels, leading to increased greenhouse gas emissions, which contribute to climate change, and destruction of animal habitats and ecosystems. Much is being done to prevent all these impacts of war, but much more needs to be done, and universities have vital roles to play. And of course, we'll be exploring that today. These universities have roles not only in the prevention of the consequences of war, but also in the prevention of war itself, in the promotion of peace. Our first speaker today is Debbie Guha-Sapir. She is an epidemiologist and professor at the Center for Research on Epidemiology of Disasters at the Université Louvain in Brussels. And she's also a senior fellow at the Bloomberg School of Public Health at Johns Hopkins University. She has performed and supervised the performing of many, many epidemiological studies on armed conflict, natural disasters, and other humanitarian emergencies in Chad, Somalia, Darfur, Ethiopia, and many other locations. She's established 2 global databases at the Center for Research on Epidemiology of Disasters. One of the databases is on natural disasters, and the other is on armed conflict and other complex humanitarian emergencies. And with these databases, she and her colleagues have been able to pool data, share their findings widely, and improve epidemiological methods. Debbie recognizes the importance of translating science into policy, action, and social change, and she communicates her research findings and policy recommendations through journal articles and the mainstream media. Debbie, welcome to the satellite session.
Thank you. Thank you, Barry. Thank you for having included me in this group. Clearly, it is the role of universities in the training of young or even not so young mid-career staff or people who want to be involved in humanitarian work is in fact an extremely important driver towards an improvement of human resources. When I think of when I started my career many years ago, I don't even want to put a date on it, it was very much more of a ad hoc professionalism, ad hoc, I don't know whether that makes sense, ad hoc professional, where just individuals who were well-intentioned and wanted to be engaged in resolving crisis situations or bringing succor to the victims were jumped into the puddle, as it were, and just did the best they can. This was, I started with MSF. It was in the early 1980s or even later. Since then, I must say that the universities have taken up cudgels, and today, many of the big global health programs around the world and the universities, both in North America and in Western Europe and increasingly in other parts of the world, have actually taken the whole issue of public health and epidemiology in humanitarian crisis much more seriously. Now, I'm going to just briefly go over some, in fact, 4 points related to which is what I was invited here for, on mortality and essentially data in humanitarian crisis. I mean, what over time, for reasons of opportunity and interest, mortality has been something that I've been working on for a very long time. The application of epidemiology, of course, is, generally speaking, is for detection of patterns and detection of trends, and most importantly, of risk factors. I mean, this is a very short description of what epidemiology is, but that essentially is the facet which it brings to humanitarian crisis. Now, counting the dead. I mean, Les is going to talk about this with much more understanding of the field, and he has done a lot of work in this, and many others on the panel as well. But counting the dead is an odd kind of a thing to do, because in fact, when you're dead, most of the time you're out of the game. So in other words, dead people are not really a burden on quote unquote society or humanitarian aid anymore. They're dead. It's the end of a process. So in other words, counting the dead becomes a exercise which must have some other value. And what are the four main objectives of counting the dead? One is, and has always been, advocacy. Right? So it's important for people to know how many people have died, and it's important to raise funds on that basis. It's important to explain to the world the severity or the seriousness of what is going on. Counting the dead, you say how many people have died, and that makes that can make a big difference to bringing aid or bringing attention to the people who are still living. The second point that the death tolls often contribute to counting the dead is prosecution. So once there is a prosecution process going on, and this I've been involved in several, the more latest being the ICC case between Congo and Uganda. Counting the dead for prosecution becomes very important, both in the ICC, both in the International Criminal Court and in the International Court of Justice, one of which is state quarrels between state, and one of them is prosecution of an individual. Number of deaths and who died and why is extremely important. And Jennifer is probably going to pick up on this because it has implications. If it's an individual, it has implications of genocidal objectives or other kinds of ethnic oppression. So prosecutions in international courts need death tolls. The third point that counting deaths contribute to, the usefulness of counting death, is very simply epidemiology and public health, as I said earlier on, to understand trends of why people are dying, where people are dying, and preferably how people are dying. And this has been a bit neglected, and I'd like to plug this over here in this particular forum. While we have spent a lot of time and a lot of interest and a lot of effort in trying to get a death toll from an event, either a conflict or a natural disaster, we have spent much less time in finding out why people have died. So in other words, cause of death. And until we moved on to that next step, that is devoting some attention to cause of death, I think we are going to be stuck in just finding some impressive number of the number of people who've died and not understand anything about what this number actually means. And the last contribution that death tolls make is for program planning. And this is rather a bread and butter kind of an issue. Whether the deaths are increasing, premature deaths are increasing, what kind of deaths are occurring, where are they occurring, and how do we then distribute resources to those kinds of targeted areas or targeted population groups, and that makes our aid much more efficient and effective. So I will just end by saying just a little bit on how sensitive this mortality issue is. It sounds like, in a sense, if you think about it, you think that, okay, you count the deaths, the person has died, you note it down in a notebook, and you tally it, and you get it. But it is extremely sensitive for many reasons, and some of it that I'm sure many of you are aware of. First of all, deaths are not binary. And that sounds like an odd thing to say. It's that, it's either you're dead or you're not. But in fact, in these situations, death, the status of death is not a binary situation, because the biggest aspect is that missing and death get mixed up. And this can change the number to a factor of 5, 6, 7 times the real number of people who did. So missing people get packed into this, and depending on the politics of the death toll, so if you have a situation where a larger number of deaths is of interest to the government, that is to show many people have died, it might be to get more humanitarian aid, it might be to show that the rebels are bad guys, and so on and so forth. If you want to inflate the number of deaths, stick the missing in it, and you can get 3, 4, 5 times the number. Or you can have the opposite. If you want to have, a government wants to have a smaller death toll, and this has happened to us, smaller death toll, because they feel that they have not responded correctly after a natural disaster, for example. Philippines is a very good case. Then you will have a government that will say, no, it's not 10,245 people who have died. It's actually only 3,200 because they don't want to be seen as being inadequate and having made a inadequate response. So that would be more or less my last point. I think I'll just end with one quick comment on the problem of theory and practice. And that is a delicate balance that the university programs of global health and humanitarian crisis have not yet resolved. The delicate balance between theory and practice, and that is the challenge I think we need to face in the next few years. With that, thank you very much, Barry.
Debbie, thank you. Thank you very, very much. Our next speaker is Ella Watson-Stryker. Ella is a humanitarian representative to the United States for Doctors Without Borders, or also known as Médecins Sans Frontières, and MSF. MSF provides emergency medical care for people affected by armed conflicts, disease outbreaks, natural disasters who are without access to health care. She has participated on the humanitarian representation team of MSF, which engages governments, policymakers, and others to inform and influence policies and practices affecting humanitarian situations and MSF's own medical operations. Ella participated in the response to the Ebola outbreak in 3 West African countries in 2014, and has since responded with MSF to multiple humanitarian emergencies, including in the Democratic Republic of Congo, South Sudan, Myanmar, Kenya, Tanzania, Greece, and in the United States. Ella?
Thanks so much. 2 points that Debbie made that I think really work well into what I'm going to talk about is first that reflection on professionalism of humanitarian action and how in the beginning humanitarian aid was not particularly professionalized, and we have a debate even today on whether and how much it should be professionalized. So putting that out there. And then the second is the problem of theory and practice. And this is something that I encounter on a regular basis. At the response level, we often are lacking responses that are based on and could be informed by better theory that would have actually improved the practice. But I also spend a lot of time now in Washington, D.C. talking to people who are not practitioners, who maybe have a couple weeks here and there of actual exposure to a humanitarian response, but are very, very familiar with the theory. And often their work is stymied by the fact that they don't understand what it looks like when you try to do it in real life. And so I think that indeed is a major challenge. I have no solutions for it other than that everyone probably needs to study more theory and have more exposure to the actual practice. I always hesitate to be MSF talking on behalf of humanitarian organizations because we are really very different from many other humanitarian organizations. One of the ways in which we are different is that we don't take government funding. So we're not funded by the US or other major governments, which changes a lot of how we approach humanitarian aid and how we speak out and position ourselves in times of crisis. I think it's important for you to understand when I'm talking about humanitarians, this word has a lot of connotations. It's really an adjective that gets thrown around a lot. Angelina Jolie is a humanitarian, Barack Obama is a humanitarian, the US military does humanitarian action. That's not what I'm talking about. I'm talking about humanitarian, if you will, with a capital H and a much narrower definition. So when we're talking about humanitarian aid, we're talking about really a narrowly defined action taken to save lives and alleviate suffering and hopefully restore some level of dignity during a crisis and in the immediate aftermath of a crisis. Humanitarian aid is different from international development. So international development work really seeks to address the deeper structural issues, economic inequalities, solving poverty, things like that. And it's really focused on strengthening institutions and systems of governance. That is not what humanitarian aid is. Humanitarian aid is not meant to end the war. It's not meant to build a health system. It's not meant to reform the financial sector of a country. It's really there to stabilize the situation, to save lives, restore dignity. MSF is a principled humanitarian organization. So this means that the principles of humanity, neutrality, impartiality, and independence guide the work that we do. And we're a medical organization, so we also adhere to principles of medical ethics and this idea of do no harm. These humanitarian principles are not only about a moral or an ethical approach to working with vulnerable populations in crisis, but they're really the basis for the legal protections that are afforded to humanitarian organizations and humanitarian workers under the Geneva Conventions, which form the source of international humanitarian law. And so when humanitarian organizations work in conflict settings, we do so with the understanding that we have a protected status, that we are present in, but we are not party to the conflict. Under international humanitarian law, humanitarian aid workers are a protected class. We are not targets of war. We should not be targets of war. And delivering medical care in conflict settings does come with many complications. So access to populations in conflict requires negotiation. Parties to a conflict might seek to limit access of humanitarians in order to punish a population. We have many examples right now in the world of places where populations are under siege as a tactic of warring factions to control or punish that population. So parts of Ukraine where we do not have access, parts of Democratic Republic of Congo where humanitarian aid has been interfered with or limited. Northeast Nigeria is another example, parts of Cameroon, I could keep going. But this is one of the ways that in conflict, humanitarian aid becomes very complicated. We also see situations where the combatants might want to manipulate humanitarian aid or take over aid resources in order to position themselves as having been the ones who brought those resources to the population. And so that ability to maintain our independence, that ability to separate humanitarian aid from political processes of conflict is really, really essential. We also see that in some places, international humanitarian aid is seen as a threat to cultural norms or the societal level changes that a warring faction is trying to bring on that population. So thinking about restrictions on humanitarian aid workers in Yemen, for example, where female aid workers are asked to respect mahram, respect this idea that a male relative has to accompany them in their daily work. Is an example of where we see some of those limitations. In other places, parties to a conflict might tell us you can't have women working in this area, or you cannot have foreigners working in this area, or you cannot have non-Muslims working in this area. So those are also issues that come up that we have to deal with and find a way to navigate in adherence with international law and in adherence with humanitarian principles. I think it's important also to remember that humanitarian aid really shouldn't exist. Humanitarian aid is in this very uncomfortable situation in that if the world were the way it should be, there would not be a need for humanitarian aid. We respond when there are failures in governments. We respond when governments cannot or will not meet the needs of their populations or the people within their territories. And conflict is one of, if not the major driver of humanitarian crises that MSF responds to. As I know will be discussed in more detail, the effects of war are often indiscriminate, with civilians caught in the crossfire, and also the direct destruction of civilian infrastructure. And some of what Debbie was saying comes to light here as well. It's not just that people are dying as war wounded, it's that people are dying because health systems have been destroyed. People are dying because it's not safe for them to access medical care. They're dying because the supply chain of essential medicines has been interrupted. They're dying because child vaccination programs haven't been able to continue as planned. And so these are all the gaps that humanitarian medicine tries to fill. I think we should also keep in mind that humanitarian aid is not only something that happens somewhere else. It's not distant to us. I found myself in Detroit, Michigan during the beginning of the COVID-19 epidemic, because in the United States and Belgium and Spain and several countries in Europe and North America, MSF actually responded in nursing homes because governments were not able to implement the basic infection prevention and control protocols that we use on a regular basis in outbreak control situations in order to protect residents of nursing homes and the workers there. So to really drive home humanitarian aid workers are in places where governance has failed, including in wealthy countries. So the question then for universities is who makes an ideal humanitarian aid worker? And I want to be absolutely clear that the majority of humanitarian aid workers, about 90% of staff that are working with MSF, are local to the crisis. And this makes sense. They're the people who are there. They're the ultimate first responder. They're often themselves also affected by the crisis at hand. And yet they are the ones who are responding in real time. And so I think a key message to universities is how can you extend resources to that population? How can you extend resources for local level humanitarian aid workers so that they can have equal access to professional resources, to tools, and to opportunities to build their skill set in order to better serve their populations and their communities. On MSF side, we really look for people who are motivated by humanitarian spirit to work in solidarity with people affected by crisis. And of course, we need a lot of different professionals. It's not just doctors. Doctors, psychologists, epidemiologists are all needed. But we also need supply chain experts, water and sanitation experts, people who know how to do finance and human resources and communications are also really important to the effort. When it comes to clinical staff, we always need surgeons, we always need anesthesiologists and OBGYNs, but we also need generalists. We need people who can diagnose a patient in a low resource setting based on examination of that patient, not requiring a lot of advanced labs or imaging, which just might not be available in that place. We also need people with management skills who are teachers or trainers, because a lot of the work we do is actually a transfer of skill and capacity at the local level. We need negotiators, people who know how to engage in interest-based negotiation. It's incredibly important. It's a huge part of the work that we do to unblock humanitarian aid. Especially for universities in the United States, please tell your students to study languages. It's really embarrassing as an American to engage in a world where we think everyone is just going to work in English. That is not how it works in the humanitarian world. You need at least 2 languages that you can work in. More is better. Most of our colleagues are working in 3 or 4 languages easily and have a couple other languages that they can throw in if really desperate. So really focusing on English, French, Arabic, Spanish, Portuguese, Kiswahili as major languages that are needed. And then equally important, I think, are the soft skills that we often forget about. We need people with high emotional intelligence. We work in situations that are constantly changing. We need people who can change and adapt with the situation on the ground. When I was in graduate school, I complained a lot that the entire experience was just one giant group assignment, but it's probably the aspect of my education, if I'm honest, that best prepared me for what my real life work would be, because no one's providing medical care to a camp of 50,000 people all by themselves. It's always a team effort. And learning how to work effectively in a team is a really important skill. It's also true that a lot of the work is uncomfortable, and I don't mean bucket showers and insects and snakes and pit latrines. I mean, we complain about those things, but really uncomfortable in the sense of working in a situation with perpetual insecurity, where we really can't control most of the factors that are affecting our patient population and our own security and lives. I mean the discomfort of bearing witness to extreme levels of human suffering for prolonged periods of time and really feeling this helplessness in our ability to improve or change anything, but you still have to get up tomorrow and try. So people who are prepared for that kind of environment in terms of a working life. And that's why we really increasingly in recruitment are looking for people who are physically, mentally, and emotionally healthy. Humanitarian work, especially work in conflict settings, is incredibly demanding on our bodies, on our brains, on our spirit. It's essential that we learn how to recognize our stress triggers and how to manage those triggers. I have seen a wide variety of coping mechanisms, and the people who resort to alcohol and drug abuse do not last very long, and they don't do much good on the ground compared to the people whose coping mechanisms involve knitting and yoga. And so really thinking through some of those aspects of how to prepare yourself to work in this career need to be addressed. And I think university students are under a lot of pressure. Life doesn't get easier. You either learn how to cope with it or you don't. And that's a place that universities could really help students to understand that their own well-being on an individual level is an important part of their career advancement. It's an important part of their ability to give back to others and to do really important work that hopefully will make the world a more just place in the long run, but in the short term makes the world more survivable for people who are in the most vulnerable situations, people who are just trying to get through a crisis. So we need more people in the humanitarian sector. And we need people who are really well prepared. So I guess in summary, I'm coming out on the side of, I do think this should be a professionalized area. And I do think that there's a lot more that could be done. So thank you.
Thank you very much, Ella. I'd like to give Debbie a few minutes to comment or on what Ella's presented. Debbie, I know you need to leave at 1:45 Eastern time. And so I'm just wondering if you have some comments or other remarks that you'd like to make at this point. Debbie may not be with us right at the moment.
No,
Yeah,
I'm there. I'm absolutely there. I turned my video off. Sorry about this. Yeah, well, Ella made a very, very appealing, I think, presentation, and especially, the point she ended with about professionalizing the whole area. I think that speaks directly to what universities can do. I must say that in the last, say, maybe even 2 decades, from the beginning of 2000s onwards, I have seen a very, very great drive to actually professionalize the whole area. And NGOs, to their credit, to their great credit, have moved away from having a kind of a charitable, we are NGOs, we just need to do good, that's good enough, wanting to do good is good enough. From that kind of a mindset, they have actually, and that's why I was talking about the human resources. I think recruitment among NGOs, responsible NGOs, not just Western ones, but even the ones from developing countries, recruitment has become much more difficult, and that's a good sign. People say, I don't get a job in the humanitarian sector, I don't get a job with the NGOs. It's a good sign. It's a good sign. It means that the non-governmental, the frontline workers, the frontline organizations are actually much more demanding. That has happened, and if we can continue that push, and the universities can come up with producing, supplying a well-trained, balanced personnel into this field, into the pool, then I think we've got a big, moved ahead, made a big leap forward. Yeah.
Mm-hmm. Mm-hmm. Ella, do you want anything further you'd like to say before I introduce Jennifer as the next speaker?
No.
Okay, thank you very much. Thank you both. So the next speaker is Jennifer Leaning. She is Professor Emeritus of the Practice of Health and Human Rights at the Harvard Chan School of Public Health. She's former director and now a senior fellow at the FXB Center for Health and Human Rights at Harvard University. And she's also associate professor of emergency medicine at Harvard Medical School. Jennifer has participated in numerous human rights and medical investigations in many countries over the years. She's also engaged with UN offices, humanitarian organizations, the International Committee of the Red Cross, and the International Criminal Tribunal. She's written widely on violation of human rights, and she is senior editor of 3 books on human rights and related subjects. Jennifer?
Yes, Barry, thank you. And I really appreciate the opportunity of sharing this presentation with Ella and Debbie and you. My sense about how universities can prepare people to be humanitarian aid workers is guarded. And it's because I think once you graduate from university, you are just starting to be prepared to engage in complex enterprises. And in many ways, that's good. Universities should expand people's horizons, ask them to explore a range of different topics move beyond their comfort zone. So if you come in thinking you're going to be a mathematician, it would be great if you actually fell in love with British literature. And it's a part of growing up at a university to come out and realize that there are many things you don't know and you still need to explore. So from my perspective, the sorts of things that people should learn in universities are exactly what Debbie and Ella have been talking about. The complexities, the moral and political issues that surround the work, the extreme hardship actually of being a field humanitarian in war or oppression. And it's also very hard if you're there because of a natural disaster, because a natural disaster is never something natural and it is never apolitical. So I believe that there should be in universities many courses with joint people who have overlapping as well as parallel expertise. And I think that the people who are teachers should have very, very engaged understanding, if not long-term experience in humanitarian work in the field, as it said, in the field as Ella has described it, where there's high insecurity, often difficult group dynamics, physically uncomfortable, exhausting, and for weeks, if not months at a time. Humanitarians need a break, and often they don't get a break. I recall teaching a class on humanitarian studies in the mid-2000s. I mean, I've been doing this for a very long time. I feel the same as Debbie about this problem of when to say I started and when to say I finished. It's not easy to recollect at this point. But what I'm saying is in mid-2000s, the class that I was teaching on humanitarian crises suddenly had the most astounding students who are coming in, getting their master's in public health, very experienced humanitarians who had gotten burned out in the wars of the early 2000s, and not just the wars in the Mideast, but also in Africa, and were sent by their institutions to work in the university and get some clarity and background. I mean, a major issue was the Rwandan genocide, which basically caused many, many people to find it very difficult to continue working. But it was all the other wars that were very difficult. And it hasn't gotten any easier. But I welcome these seasoned people in the class because they could almost help me co-teach undergraduates. I mean, one of the things that I really want people to realize is that undergraduates at universities still have a great deal of growing up to do. And part of that growing up is going to be taking other courses, getting professional degrees in medicine or nursing or in water management as engineers. There's a wide range of skill sets that are needed. And also to have coaches and people who are watching their career and saying, you need this, you need that. And I cannot underscore more strongly, Ella was very polite, but Americans with just English are relatively useless. I mean, they're good in medical care, maybe, if they are able to communicate with people who have also learned English. But it is really it's not disability. I mean, English is a marvelous language. And I, unfortunately, am one of those who, despite taking French for a long time, didn't use it. So my French is pretty bad. But it gets better in these emergency settings because it has to, and then it fades away. This is just a point I'm making, that studying languages is going to be very important for people who want to go into this field. And then the other point that I'd like to make is that you need to know the history of the humanitarian enterprise and recognize that there are many ways you can participate. You can come in as a person with particular skills to evaluate the situation, as Debbie does. And essentially the meaning, the process, the evolution of death, injury, and disease. You could come into it as a medical professional. You can come into it as a number of other forms of practice. My entree has been as a human rights worker doing investigations of atrocities and violations of international humanitarian law and grave violations of human rights. And so standing somewhat adjacent to those in the humanitarian enterprise, good colleagues, good friends, people I have come to respect enormously. And yet in that slightly askance mode of interacting with people, I've come to see very clearly what some of the pitfalls are in having underprepared humanitarian aid workers or exhausted ones or ones who actually become ill in the process and don't reveal it. And I would just say to people who are teachers in universities or students who want to go into the humanitarian enterprise, that it is a physical stress. One has to be very fit mentally, physically, and I would say morally or ethically. And it's difficult to be all those three all together at the same time for months and months on end. So I recall times when I was doing a human rights evaluation, human rights. I mean, I was trying to count the dead in the early days of the wars in Somalia, the siege of Mogadishu. And I was there in Mogadishu for not very long, but I mobilized a team of Somali medical students who were interested in understanding what was happening in the war in their own city. And I was working with a colleague, but he couldn't be there at the same time. He came after I was there, just for flight and other logistics reasons. And I miss very much not having another person with me then, because it was so strenuous, so terrifying, because the city was under bombardment. And it was divided into two sides because they were rival warlords with their own armies fighting each other. And the city was the background and the context. And there were big hospitals on both sides of this line. And the humanitarian aid workers were thrown into working on helping the hospital and delivering medical care. So this is, rather early days. This is 1992. The war in Mogadishu was still raging. I got there in, I forget, January, February, and the war was, ceasefire was signed in March, I think. It started in the fall of 1991. And the city was rubble, and the hospitals were filled with patients. There were no nurses. There were no windows. The ICRC had a good hospital. MSF had a very good one. Field hospital, but very good. The government ones, where other humanitarians were working, were more of an old structures from the old days. I won't go into the history. And these are dying places, not places where people got better. I'm not saying, the exception is the Red Cross Hospital and the MSF hospital. But what had just happened before I arrived is that MSF had stood up and said, we're not going to stand with these armed actors careening into our front door in their Jeeps with their machine guns, running into the medical area and demanding that one person be taken care of over priority of others, and shoving and grabbing doctors and nurses to take care of somebody that they brought in who was recently wounded. And so they instilled the principles of the ICRC and international humanitarian law, which basically is the neutrality of the hospitals. They bargained with all the various armed actors, got them to agree. And I came about a week after that level of discipline had been imposed on the hospitals, and the medical humanitarians who were not MSF or Red Cross ones were exhausted and depleted, and they couldn't believe that there was now a relief from the terror that was in the makeshift emergency area or in the hospital. They began to become a little bit more rejuvenated because there had been some order imposed through negotiation by the MSF team that was there. And there were so many things about that experience in Mogadishu that told me about what happens to humanitarian small groups in crises and how they need to be robust. Some of them were not. About who volunteers to work in a humanitarian team. Some of the doctors that were recruited from the United States were lamentably flawed and inappropriate for the work that they were encountering. This was not a professional set of outfits in 1991. I'm not talking about the Red Cross or MSF, but I'm talking about all the others that were flocking to these war zones and humanitarian crises. And it's this caution that I have when I'm speaking about what universities can do. Not just in American universities, but universities across the world that want to be training people. I think training is crucial, but a broader education in universities and understanding of the forces, the history, the complexities of this enterprise is what people need to be exposed to. And then they need to be encouraged, this is students, to get a further professional degree of some kind. So they're going to be useful when they are able to be recruited by and enter into the humanitarian enterprise. It is an honor to be asked to work there. And then what's surprising is to I who observe it as a human rights investigator is how crushingly difficult it still is. And so I deeply respect the work that Ella and others are doing. I find that I have built a life around looking at some of the inhumane, illegal, and vicious aspects of war and crises. And in that respect, I have an overlap with Debbie, who is also understated, more understated than I, but who often, almost always sees really grave issues that get buried because people don't look for the data, they don't look for the answers, or the governments that may allow you in grudgingly don't want to hear from you at all about what is actually going on. So it is an extraordinary life to be involved either directly in or in ways that interact with the humanitarian enterprise. But I hope that I've conveyed how complex it is and how difficult it is going to be for universities to craft something that is going to be realistic, engaging, and inspiring. Thank you.
Thank you very much, Jennifer. Debbie indeed has had to leave, as she indicated earlier. Ella, I'm just wondering if you want to make any comments in relation to what Jennifer has just presented.
Well, thank you for the kind words about MSF's work in Somalia. I was definitely not old enough to be present then, but glad to know that my predecessors were doing good quality work. I think going back to this idea of preparation at the undergraduate level honestly kind of surprised me because I haven't thought about the undergraduate side. In fact, as an undergraduate, I did not know this career existed. And so very, I think, important point to make, to not forget people at the beginning of their university career. I think the other question, and I think some of the solutions to improving humanitarian aid and providing people with better quality care is to think more expansively about who is a humanitarian aid worker and to think about ways to include them in training, to give them the theory that will match their practice in essence. And that's not an easy thing because we're talking about people who are not necessarily going to have a visa to come to the country where the university is located. And so how do you build ways to support humanitarian aid workers who really do need more of a formal structure, training certificates, if not a degree program. And then on the aspect of people understanding what they're getting into, I think I had a lot of exposure because I had a close family member working in humanitarian aid, but I had no idea really what it was going to be like to be sitting in, Guinea in March of 2014 with an 80% patient mortality rate during an Ebola outbreak. I didn't understand. And I think that hopefully Les Roberts won't mind me calling him out in this context. He's on the next panel, but he was one of the only professors in my graduate education who really talked about what the mental health component was going to be like. And he was incredibly honest with us as students about what that actually entails and what that looks like. And I'm very grateful to him and the few other professors who really are practitioners who conveyed that message to us, because it's a big issue. And I think we do a disservice to people by not preparing them for that component of the work, and not just for direct aid, but also for the researchers, for people who research sexual violence, who research human rights abuses. We need a lot more support for journalists, investigative journalists working in these contexts. We need a lot more support in this area.
Yeah, thank you very much. I'm wondering if any of the speakers in the second half of the session would want to comment, Stephanie or Les or Len. If you do, just turn off turn on your screen and unmute yourselves. Len?
Thanks, Barry. Go
Les.
ahead, Les.
Go ahead, Les. I think there may be a delay. Go ahead, Les, please.
Sure. I guess my main comment is a wonderful thing happens in public health graduate schools where people who have gone out in the Peace Corps and had a really rough go of it, or some experience like that, often are self-selecting to come back and wanting to get into the humanitarian game. So thought number one is, oh my gosh, as a graduate professor in a professional school focused on humanitarian assistance, it verges on inconceivable how idealistic the students I had were and how tough many of them were. That's thought number one. And as Ella said really eloquently, most of the work is being done by our locals. And as much as we should be teaching our students about how to be well-rounded humans, physically, psychologically, morally, like our ability to support the locals on the ground and to keep calling them back for years afterwards, after you've worked with someone for a couple of years in the field, like that is as important, I think, as anything about us ourselves, because those folks left in the field, they need all the exact kind of support and sort of toughness that we're talking about here, even more than we do. Thank you.
Yeah, well said. Len, did you want to make a comment?
Sure. Jennifer and Ella have very persuasively and eloquently explained how universities are not very good at training people from scratch to become good humanitarians. That there are so many other factors that are kind of so beyond the capacity of an undergraduate program or even a graduate program to train people in the first instance. But and I'm sure Stephanie will talk about this, and we shouldn't forget it, universities have a very important role in providing various kinds of training to people who have experience in the field and want to learn more about sophisticated issues like how you set up a sanitary water system, or how you deal with issues of human rights and human rights reporting when you're a humanitarian, and a whole range of issues. And I think that's what universities have a lot to offer in the field of humanitarian work. And we should understand that that's where I think the added value is. In a way, I'm just, this is a setup for Stephanie, who is, I'm sure, going to talk about this in greater depth.
Yeah, very, very good point. Ella, from your perspective, what could universities be doing more to train local people who are providing, as you said, 90% of the humanitarian assistance? Are there specific things that you think that universities could be doing more of or differently to better support those local workers?
I think really focusing more on either certificate programs or training programs that happen in countries where there are a lot of humanitarian crises and where local workers are already located, providing funding for people so that they can participate. Cost is often a really big barrier to people who do this. I know MSF has looked at various ways of providing better in-country training and sort of a university level approach, particularly for places such as South Sudan, where there just is not that opportunity in the country. All respect to my colleagues who are trying to do that type of additional training work. We're not very good at it. It's not where our strength is. We're really a lot better at like treating people for malaria than building parallel university systems. So that kind of expertise that universities have in adult education, I think, is really important. And then also thinking through the training, the languages that things are offered in. A lot of people really, they might be sort of borderline functional in English, but they would be able to learn a lot more if courses were in Portuguese or Spanish or French or Swahili or Arabic. And so really thinking through on the university side, there are universities that have the ability to teach in all those languages. How do you match the universities who have those language capacities with the universities who have the curriculum? So.
Jennifer, I have a question for you. We've been focusing a lot on humanitarian assistance, but as you acknowledged, much of your career has been on investigating human rights violations and bearing witness in many situations and coming back and communicating about those situations. Is there more that you can suggest that universities should be doing to raising awareness about human rights and supporting students in embarking on careers in the kind of work that you've done over decades?
Yes, I mean, I think Les may be commenting on it later, but I definitely believe that at the undergraduate level, as well as the graduate school level, I mean, I've taught mainly at the graduate school level, but also at the School of Public Health, but also undergraduates, a freshman seminar even on human rights I've taught for years. It is very important for people to realize what is considered right and wrong by the international community. I mean, we live post-World War II in nested in a remarkable array of agreements, documents, rules, judgments that have formed a normative structure for the ways in which we can look at awful things, including war and different kinds of war, oppressive regimes, and the bloody mindedness of the minions of dictators in oppressive regimes. I mean, there are layers of nuance that come in an understanding of the rights and laws. And I believe it fortifies the mind if one is contemplating the world system and its miseries, to understand what has actually been deemed illegal, deeply wrong, actionable in terms of prosecution, what sort of evidence is needed to create a case that could actually stand up in a court, and what are some of the fault lines in humanitarian action and human rights work, in military action, in governments that offer aid in unrestricted ways ham-handed or in restricted ways that are
We lost. Oh,
so that's the sort of thing that I think we can teach at undergraduate levels.
mhm, mhm. Len, did you want to comment?
No, I didn't have anything more.
Okay. Jennifer, let me ask another sort of related question, and that's this. You've been, and maybe Len you might also want to comment on this, but Jennifer, you've been involved in many human rights and related medical investigations in many crisis situations. And I'm just wondering, Jennifer, from your perspective, is there more kind of training that universities could be doing to train people in investigating human rights violations and so forth?
Yes, I think so. And I know, well, everyone on this call could talk about that.
Mhm.
But I believe that the I believe what's neglected at the undergraduate level are two kinds of courses. One that will be discussing the law as it applies to humanitarian action, and the other would be the law that applies as with respect to human rights investigations in wars and other distress settings, because there are norms within human rights that don't have to be front and center if you are dealing in war zones, although they are front and center if you're dealing in an Ebola crisis. And those norms relate to, treatments of patients and power dynamics and the ways in which one is most respectful of difference, et cetera. In complex war zones, you have to pay attention to those within your team, which includes many local people. And you also have to recognize the vast power differences between those who are coming in to help, I'm using sort of old-fashioned language, and those who are in need of help. That power differential in terms of humanitarian action in wars and disasters and mass epidemics, it makes it very important for one to be self-aware in modes that are a little less necessary if you're doing a human rights investigation. There you actually have to be quite careful about your own safety in a certain way. And it's definitely true in humanitarian and war, et cetera. But it's more that, in my experience, has been getting the information, understanding how to sift it, figuring out where the answers are, has involved, it's extraordinarily interesting, human rights investigations in conflict and in other settings. But the responsibility of staying in one place for a very long time and taking care of populations is the humanitarian one that Ella's talking about. You can't be a human rights investigator in a fraught situation in a country for much more than 3 weeks without having it be known that you're around and actually putting people you talk to in danger and putting yourself in danger. So it's a very different way of looking at these crises. And so I think the courses should be separate. I find it unpleasant, just intellectually unpleasant. And when people think that they can give a course on health and human rights in war and conflict and this or whatever, these titles are, they're quite different. And I think that should be a distinction that universities, undergraduate as well as graduate, are prepared to make.
Thank you. Len, do you want to comment further on your experience at Physicians for Human Rights with regard to the roles that universities might play in training or learning from these investigations of human rights abuses?
Sure. To start with, I think some basic public health skills, including qualitative research, epidemiology, are really helpful. And that is a really terrific foundation. And an understanding of human rights and humanitarian law is also very useful if you want to investigate human rights issues in war. And it's also, just to put a little nuance on what Jennifer has just said, it's true that there are many fraught situations where security is a huge issue, but there are many situations where it's not a huge issue. And I think that there are many opportunities to do work in places that, if not totally safe, are relatively safe. So I think with a good grounding in some basic public health and skills, understanding of the law, and you don't have to be a lawyer, to just get the basic framework of both human rights law and humanitarian law, it could be a real contribution. It's a shame that most universities, I'll talk about this more later, most universities, to the extent they get involved at all in issues around war, it's about humanitarian issues, assessments of humanitarian programs or population needs, issues around refugees. Of course, that's where the funding is. And people like Les do work basically out of his own pocket because nobody's going to fund it, if I may speak for you. And the curriculum kind of follows that. So you have training in things like humanitarian needs assessments, program evaluations, but not how to conceptualize human rights investigations in war, or investigations of other aspects of war, environmental consequences of war, where again, environmental courses are really important to understand what you're seeing. And so I think on the one hand, there's a great foundation that can be made, that can be gained in especially schools of public health. But the universities themselves have fallen way short on some of the skills that would be very helpful.
Thank you, Len. Two things. Jenna, could you open up the chat so that people might participate in the chat? And second, I have a question for any of our speakers so far, and that is, can you address what is needed to strengthen enforcement mechanisms that will support our responsibility to protect?
I saw that in the chat, and I thought that should be something probably that could be addressed very well in the second session. But I would also say that it depends what one is trying to enforce in terms of legal restraints, or in terms of prosecutorial capacity, or in terms of empowering or encouraging investigators. I mean, Debbie and I both know in work, and she, I think, more deeply than I, working with the ICT, the International Criminal Tribunal, they are very short of people who are seasoned, country seasoned, language seasoned, durable, the way the humanitarian has to be, as Ella's talking. But also very skilled investigators in IHL or human rights abuses, who can go to the area that is at risk, the area of concern, and follow up in some of the studies that some of us have done. I mean, a large share of my work in human rights in war has been with Physicians for Human Rights. And I've been a board member for years, but what I would do was step down from the board and then report to people like Susanna Sirkin or Len while I was out in the field, and then come back and we'd work together to mobilize the action. And then I'd get back on the board. So in other words, I went from staff to board for, I don't know, 25 years it feels, and was with PHR. So Len's experience overlaps a lot with mine, although he was more running things. But I would come back, and then what we would talk about was, how do we get this report somewhere where somebody's going to act upon it. And that was where we had to mobilize action with the ICT or with other agencies. And then what we would find is they would not have the personnel to follow up on what we had found.
Mhm.
So then we'd have to go to the UN, or we would have, and the UN actually tried in many ways, or we would have to go to other organizations that were legal and in country to work on finding further evidence in further detail. It's a really good question when you're talking about human rights or illegal / atrocity laden actions in war. Where do you go from being a human rights worker in the civil society space to get action and traction in the actually more powerful agencies that are legally bound to investigate and create sanctions?
Stephanie, I haven't called on you yet, but do you want to make any comments on what we're discussing or have discussed?
Thanks, Barry. I think we'll have time in the second session to go in more detail about some of the issues around training, which are really important. But I am agreeing with everything that's gone before here. I think it's really important, as Jennifer said, to make sure that even at the undergraduate level, that students have a chance to interact with this material and to learn about it.
Mm-hmm.
And I completely agree with what Ella said. You know, the teaching is not just about the theory and the international humanitarian law and the skills. It's also about grit and resilience and making sure that people have some basic coping skills and teamwork skills so that they can make a long career out of this if they are lucky enough to join the humanitarian profession. Because I think we've seen a history of too many people who, you know, join up for a little adventure and end up having very short careers. And I think those days are receding as the work professionalizes. But I think that more could be done. And I think that universities, just as they have the obligation to train for many other professions, that's part of the big obligation when we're training people for this one as well.
Thank you, Stephanie. Another question really for all the panelists is, do universities have either direct or indirect role in intervening or supporting the intervention to prevent human rights abuses from occurring in the first place? Wondering if anyone would like to comment on that. Jennifer or Len in particular?
Not in my experience. No, not universities tend to be protective of their brand, which winds up being neutrality in a lot of these settings because they have funders and people they have to pay attention to. And you know, the vast constituency for universities is their graduates. And that is a population that goes way back. You know, they have 90-year-old graduates who are still sources of funding and support. So the universities, however, can be very, very helpful in promoting sectors within the university. They're actually engaged in advocacy or investigation or both. And Stephanie knows that. And I think others on this call could also talk about that. And they can honor the reports. They can give people very good places to speak to students and to alumni. They can support the development of courses, which is something that I know that Stephanie will talk about. And they can actually create an opportunity for the findings of these reports to be actually broadcast through the medium of the university, which is a very rich medium. And all of that they can do largely because they have not taken political stands on virtually anything, except things that they have to deal with in terms of their bread and butter, like, you know, the complexion of who the student body is going to be.
Let me ask a different question of Ella. Thank you, Jennifer. Ella, does MSF seek further ways in which they can, you all could communicate with universities to, you know, communicate more of what you're saying in this satellite session today? That is, in terms of ways in which universities could be more responsive to the things that you're seeing in the field?
We do. I think we have a lot of different types of relationships with universities. So many people who work for MSF have dual appointments at universities and are engaged in either research or training and teaching. We also have relationships with certain degree programs. They tend to be in Europe where the cost of higher education is affordable. The US cost of university in the US is just really, even public universities, is really prohibitive for humanitarian aid worker salaries. So less engagement, honestly, with US universities for that simple reason. But universities are also sort of, as I think it was last who was saying, people kind of go back and forth between humanitarian work and universities, sometimes because they need a break from the applied work, sometimes because they recognize there's a gap in their skill set. So there is a lot of interaction, and sometimes it's through formalized relationships. We have a formal relationship in the UK with Liverpool because they have a degree program in tropical medicine, like public health tropical medicine, that works very well with the needs of our organization. But it tends to be more often informal and individual based relationships.
Great. So I have a different question now. Many of us in public health always look upstream to see how can we either identify underlying factors that might be reflective of a developing humanitarian emergency, or to set up early warning systems that monitor abuses, and not only human rights abuses, but abuses of the environment and damage and destruction of the environment. I'm wondering if any of the panelists would like to comment on the roles that universities might play in either setting up or improving the effectiveness of early warning systems, either to monitor or identify human rights abuses at an early stage, or factors that may be leading to war, or factors that may be leading to so-called ecocide, damage to the environment. The question is really about what can universities do to improve early warning systems.
Are you addressing this to anybody?
All of you. So Jennifer, if you'd like to comment, I'd welcome that.
Well, I think they could do a lot more than they've done. I'm thinking about, this is not really early warning, but this is compensatory action. With the abrupt and calamitously messy withdrawal of the US forces from Afghanistan, millions of women and young girls were left deeply stranded and continue to be. And also tens of thousands of people who had worked over the decades with the United States during its various times of war and occupation were left exposed and without any help in terms of getting out. And I know through experience with universities, I won't go further than that the response was, well, we take only scholars that we rescue, on a case by case, shoehorn kind of basis. And and I think perhaps there have been universities who have not been Ivy League, who have not been so fussy about who they're asking into their student body, et cetera, who have been more welcoming. But if US and European universities had really opened their doors for places for people to come who were fleeing, who needed to get out. I'm not talking about the massive Afghan woman, but I'm talking about the masses of people who had been helpful to the international effort to deal with the Taliban. And here the US universities really come into sharp focus. There would have been places to take people, and there could have been much more effective advocacy in terms of visas and letters and pressure and funding, and it didn't happen. And I feel that is something to comment on from the standpoint of role of universities.
Mhm.
They need to be aware that they are in the same way that old monasteries were, that they are a haven for people who need support. And just because they're intellectual havens doesn't mean that they won't benefit from and be of benefit to a wide range of competent people who have stood up for human rights and choices of a wider range than were offered within oppressive regimes. Don't get me started. Actually, I feel very strongly that there's so much more that needs to be done.
Mhm, mhm. One of the attendees of the session has written in commenting that the perpetual insecurity that people face who are living through humanitarian crises in other countries has some similarities to the perpetual insecurity of people living in cities in the global north, including in the United States. And I'm wondering if Jennifer or Ella or one of the other speakers would like to comment on whether universities have some role to address that perpetual insecurity among people.
Yes.
Ella or Jennifer?
I would just say that's a fair question, particularly given my somewhat impassioned sense that the universities are lacking in dealing with people who are left stranded by our kind of military and overseas actions. That there are people left stranded because our society is what it's like, and we should be attending to that as well. So I think the parallels are profound, and I'm glad somebody raised it. I don't have an easy answer, except
Ella, do you want? Yeah. Thank you, Jennifer. Ella, do you want to comment on that at all, based on your work in Detroit?
I mean, I agree. I mean, working in Detroit we were there in nursing homes because they were unable to implement the basic infection prevention and control standards that were necessary to prevent the workers and residents from getting COVID-19. And that's a humanitarian skill set that honestly, I think a lot of us in MSF had taken for granted, that we know how to operate in an outbreak environment. We know how to adapt protections and procedures to that environment. And this was actually a skill set that we had, that we could, basically roll up to nursing homes and say, hey, do you want some training in this? And they said yes. So it was a very much a sort of humanitarian motivation, a humanitarian response, not just in the US, but in a lot of different places. But I think the reason that we were in Detroit, the reason that we were in Houston, the reason that we chose certain communities in Belgium is because those were populations where no one else was advocating for them. They were bearing a disproportionate burden of death and disability from the COVID-19 outbreak. And there was really a shocking lack of response for those populations compared to other more privileged populations. And so it was the same as, when we work in any other location, you look for where no one else is present. You look for the population that just otherwise does not have support and access to healthcare. When it comes to gun violence, a lot of the work, the advocacy work, would be the same skill set that we would look for in humanitarian aid workers: the ability to collect and analyze data and convert it into something that the rest of the world can understand, the ability to identify the power brokers and best bring messages to them in a way that they can hear and respond to, the process of gathering support from constituency. I mean, all of those are skills that translate very nicely into humanitarian work. So absolutely be thrilled to see universities take that on.
Thank you very much, Ella. We're going to take a 10-minute break now, and we will reconvene at exactly 2:35 Eastern time, and we'll pick up with our three other presenters and further discussion. Thank you, everyone. And so we'll take a 10-minute break starting now. Stephanie will start in about one more minute. Well, welcome back, everyone. As we start the second half of our satellite session, I'd like to introduce Stephanie Caden. Stephanie is an emergency medicine physician who focuses on international humanitarian response and building leadership for the international humanitarian response. She's an associate professor at Harvard Medical School and the Harvard Chan School of Public Health, and deputy chair of the Department of Emergency Medicine at Brigham and Women's Hospital in Boston. Stephanie is deputy editor of the Journal of Disaster Medicine and Public Health Preparedness, and is a member of the core faculty of the Harvard Humanitarian Initiative, which trains professionals in global health and humanitarian work. Stephanie has worked in more than 40 countries where she has worked to improve emergency medicine systems, humanitarian aid, and disaster response. Stephanie, it's a pleasure to have you with us today. And please unmute yourself as we start.
Thank you so much, Barry, for that introduction, and greetings to all of you. I have to apologize in advance that I am getting over a little bit of a cold, and so I may have a bit of a cough, so apologies if I have to pause and work something out. I am going to be speaking today about the role of universities in training humanitarian workers. And as Barry told you in the introduction, we have done a lot of that here at Harvard. I have to also tip my hat to Jennifer Laning, who was one of the originators of this line of training at Harvard. Not one of the, she was the originator. And I myself have been a student of Jennifer's and have benefited from the training I got in my degree programs here. And since Jennifer originated this, we've really tried to grow humanitarian training extensively and change the way we reach out to future humanitarian aid workers and students of humanitarian aid. And so I thought what I would do is just share our experience by way of context and tell you about the three major ways that we try to reach humanitarian students. And then we can go over a few of the challenges and constraints and maybe open some of that up to the discussion after my colleagues finish their presentations. So we have, in training at Harvard, we have a three-tiered approach to this. The first is courses that we offer as part of a university degree. The second is we have a series of open access, tuition-based in-person workshops or hybrid workshops that we use, and that allows us to open these offerings to people around the world. And third, and probably the most exciting one for me, is a growing number of online training opportunities, podcasts, videos that are open access and easy to access for anybody around the world without having to come into the States or to Boston. So I'll go through a little bit what that looks like in each of those. So first, courses for a degree. As I briefly mentioned in the last session, we start these courses at the undergraduate level. So we teach an undergraduate survey course about humanitarian response and disasters, refugee crises. I actually teach this with a colleague of mine, Michael Van Rooyen, who is the current director of the Harvard Humanitarian Initiative, which is essentially the humanitarian arm of Harvard University. And the undergraduate course is really an introductory kind of a survey course, just to get the undergraduates exposed to the issues that we are teaching. I like starting at the undergraduate level first, because undergraduates, for those of you who teach undergraduates, you know, they tend to have no filter and they are wonderful to dive into discussions with. And we use not only cases from the past, but we also use some current cases. The war in Ukraine, for example, is commonly in the news, and it provides wonderful examples that we can use for things like international humanitarian law points. So we start the training at the undergraduate level. At the graduate level is where we have most of the training throughout the university. That is centered mostly in a humanitarian studies certificate. So at Harvard, we don't yet have a degree that's a humanitarian aid degree, as I know some universities do. But rather, what our students can do is, if they're taking, say, a Master in Public Health degree or a Master's in Education, they can get a humanitarian studies certificate with it. The graduate courses have some humanitarian history, some more theoretical bits of knowledge, but they tend to focus in on hard skills, on very practical things that people will need to know in the field, such as we do media training, for example. And then we also focus on putting people into simulated experiences so that they can build the resilience they need to do the work. And I'll speak a little bit more about that in a moment when I talk about some of our workshops. And the last part that we offer for our Harvard degree students is there are research grants available for students who want to do research in humanitarian aid. So for the students who are enrolled at Harvard, those are the opportunities that we have, and we continue to grow those courses out. Now, the second major push, and really where this sort of started, was in our tuition-based open access in-person workshops. And those have grown over the years. So we started with a 2-week sort of humanitarian boot camp. It's called our Humanitarian Response Intensive course. And that ends in a big 250-person 3-day field simulation. The point of which is to take our students and not only just sort of test out in open air in the field the knowledge that they've learned in the course, but also, and primarily, the point there is to put them under a certain amount of physical and emotional discomfort, a certain amount of stress, to allow them to feel a little bit of what it feels like to be a humanitarian worker in the field. So we put them under time pressure. The time of year we do this in New England is cold. They're uncomfortable. They're sleeping outside. They're not taking showers. And then we also have a very well-trained humanitarian security expert, actually a couple of experts that come in, and they run them through some security issues in the field that tend to be very realistic. And all of this allows the students to feel how they react as individuals to the discomforts and the stressors of humanitarian work, and how they perform in teams. And then we do a debrief of that afterwards. And for me, that's really the most important part of the simulation. Even more important than, can they calculate a crude mortality rate while they're in the field? In addition to that workshop, we have a series of other workshops that invite people in for a short amount of time, usually several days to a week, where we focus on other topics like urban humanitarian emergencies, monitoring and evaluation. We have a geospatial technologies course, a course in humanitarian negotiation, and several offerings in humanitarian leadership. Now, one of the big things that we try to do and that we recognize is that it can be very difficult and very costly for students from lower income countries or the global south to come to Boston, no matter how cheap we try to make these courses. And we do try to keep the cost extremely low. Just to fly to Boston and stay there, for a week for a course can be a lot. So we have tried to take some of these courses on the road, as it were, into other countries. And we've done them in Haiti, and most recently in Ukraine. We have taken some humanitarian oriented courses there, but so that we can offer them in the local languages and do the training locally. But that tends to be logistically very complex, and maybe we can talk about that a little bit later in the challenges. The third way that we offer courses is in online training and in other online offerings like podcasts or videos. So we at Harvard were part of the team that built the Building a Better Response course. This was a joint project funded by USAID with IMC and Concern, but it's had many tens of thousands of humanitarian aid workers take it over the years, and we originated the curriculum out of Harvard, and we continue to sort of maintain that. That's free and open access. Also on the edX platform, there's a Harvard X course called the Humanitarian Response to Conflict and Disaster that's been very popular and is open to everyone as well. And we've been trying to move more and more of our course offerings online. We have a needs assessment course. There's also a sort of do-it-yourself leadership, management, technical skills course that we offer, and a series of podcasts and YouTube videos that's been offered through the ATA program, covering a lot of the humanitarian negotiation and leadership topics as well. What I think we'd like to see is more online training so that more people around the world have access to these really key issues. But as I think everyone here knows, it takes a lot of funding, a lot of money, and a lot of experts to flip courses to an online mode and do them really well. And that's been a real barrier for us as we try to do that. So I think just to leave you with a few of the challenges that we've seen in trying to reach the students, both from Harvard and the global north, but also in the global south. And I won't say that we don't reach students from the global south. Actually, for our tuition-based workshops, most of the students who take those workshops, the in-person workshops, are actually from the global south. And for the online training, a great majority are, but I think we could still do better. So the first challenge we have is actually continuing to try to reach students in the global south or people who are in need of just-in-time training in the field, and trying to move more of this material online where it's more easily accessible. Second challenge we face is getting speakers from the field. Humanitarians are wonderfully generous people, and when we ask a field humanitarian to speak in one of our courses, we always get a yes. But we frequently run into the problem of, an emergency happens and then they get deployed and then they can't come to the class. And so it's been a real struggle. This year we were able to get a little funding to bring in some speakers in a more controlled way so that they could come and have that time set aside from their jobs. But that can be a challenge on both ends. Also, because we're in a university, universities sometimes put limitations on the time away from school that both our faculty and our students can spend, which is really tough when you're in a field that requires work overseas. Another major challenge that we've seen is, and that has taken us honestly a long time to negotiate, is the university's security concerns. So working out a plan with the university so that they feel comfortable enough to let our faculty go into the field. We don't typically send our students into the war zones, but when there's something happening in the world that's a disaster or war, that is where our faculty and our researchers are going. And it has taken us a long time and many meetings and lots of planning and very good security planning to make the university sort of get used to that. They're not used to sending folks into the field. So we can talk about how we do that as well. And then finally, and this is something that's a little bit sort of selfish for our faculty. Faculty who are in this field, we have seen, some of them have had trouble with getting promoted at a regular pace because of issues like that we try to do for decolonizing global health, the shared authorship issues in Harvard's promotions process, at least. It can be very difficult to explain why, I'm not first author on that study, even though it was mine. I'm sharing the authorship of the studies that we produce with my field colleagues, which we think is right and good. But the university doesn't seem to always see it that way. And also just a recognition that, the effort that it takes to go into the field and do a study and spend a month doing household surveys or whatever you're doing, the field data collection just takes a long time. And compared, so I'm based primarily at the medical school and also at the School of Public Health, but compared to some of my colleagues who just mine large data sets, that one can be a little bit hard as well. It's just a very different thing to produce good humanitarian research. And so the process of promotion and the recognition for the hard work that our humanitarian faculty do is sometimes slow in coming. So I hope I've opened up a few issues that we can discuss later, but now I'll turn it back to Barry for the next session.
Thank you very much, Stephanie. Our next speaker is Les Roberts. He's an epidemiologist who started his career as an epidemic intelligence service officer with the Centers for Disease Control and Prevention, at which time he was assessing the health of refugees in several different countries. Later in his career, became Director of Health Policy for the International Rescue Committee. He has been, for many years, a professor in the program on forced migration and health at Columbia University, where he's now a professor emeritus. Overall, Les has directed more than 50 epidemiological surveys in more than 17 countries, mainly on mortality caused by armed conflict. And many of these studies during war have led to protection of civilians, and also some of them actually led to the end of those wars, that he was able to document the mortality of. In the past two years, Les has worked primarily on COVID-19 and mortality studies in the Central African Republic. Les?
Barry, thanks so much for inviting me and for the introduction. Hi, folks. I'd actually like to start with a sort of a slightly different tact than a couple of the other talks, and that is, I'd like to talk about the main problem on the planet and how I think Northern universities are uniquely well situated to help solve it, and that problem is inequity. You know, I am just so fascinated by people who think that they're Buddhists or Christians or what have you, think it's okay that I can say, oh, I want to make my country great again. My country comes first. And nationality is this weird thing. Think about it. If a child is born in the United States, they will, by their 18th birthday, have 1,000 to 2,000 times more money spent on their education than someone born in Chad or Mali or Niger or the Central African Republic or South Sudan. They'll be 10 to 20 times more likely to die if they're born in one of those poor countries of violence. They'll be 50 times more likely to die before their 5th birthday. They will earn 1 to 2% as much over their whole livelihoods. Like, we have this inequity built into our country that's justified by this weird new concept of nationality that's only been around a couple hundred years. And I have been so encouraged, like just so encouraged during the COVID outbreak that the issue of vaccine equity has, for the first time in my life, just sort of overwhelmed the notion of nationality. You know, during the 90s, the access to antiretrovirals and HIV issue made us struggle with this a little, but not like we saw with COVID vaccine. In my Republican neighborhood, I had neighbors saying, you know, I can't go get a 3rd vaccine when most of the world hasn't gotten their 1st yet. What a beautiful, beautiful thing. And the one thing that I think competes with this is deaths and both individual events or tallies in times of war. You may remember this picture from 7 years ago, I believe. It's a child, he's a Syrian refugee, washed up on a beach in Greece. In the months after this, EU funding for support of refugees in Turkey more than doubled. In the week after this picture was published, 10,000 households in little tiny Iceland signed up to host a refugee family from Syria. Wow, it is just astonishing what both mortality data and mortality stories can do to bring out the best in humanity and to bring out compassion that transcends this weird thing of nationality. And I really liked Debbie's start in the beginning that there are these 4 reasons for measuring mortality advocacy, like this picture was a form of. And there are other examples like IRC measuring mortality in Eastern Congo, triggering within a week of the first report a UN resolution that the 5 invading armies need to get out. And that first IRC study increased by 10-fold US government funding in Eastern Congo. Like, that was pretty cool. But there's several other really important things that come about for measuring mortality in conflicts. And I'd like to just talk about a couple of them for like 3 minutes. One of the first really sort of impressive mortality studies in an emergency was done by Al Summer, who later became the dean of the Johns Hopkins School of Public Health. And they sort of flew over an area after a terrible hurricane struck and tried to figure out where was affected. They then went and interviewed over 3,000 households, and they estimated that there were about 225,000 people had died. And then, amazingly, 20 years later, almost an identical storm hit almost the exact same spot, only now the population had more than doubled in the lowlands of what's now Bangladesh. And the death toll the second time around was less than 10% of the first time around. And it was mostly explained and blamed on these hurricane shelters that you see down here in the picture that started to be built after the 1970 hurricane. Like, this lesson has repeated the need for hurricane shelters across many, many places on the globe. So sometimes just making a tally helps us learn basic public health and science. You know, your new friend, Jennifer Leaning, is one of the authors on a report that was done about Hurricane Maria in Puerto Rico when it struck in 2017. I don't know if you remember, but the White House and the federal government said only a few dozen people died. They did a great job. And some local academics got some colleagues from Harvard, and they got together and they did a household survey, and they estimated 5,000 deaths from that survey. Then they looked at the death certificates that had been issued in the months after the hurricane and concluded there are at least 3,000 extra death certificates issued. And when President Trump dismissed this study, Fox News mocked him for dismissing what they called the Harvard study. Sometimes data can just transcend politics in an amazing manner. But in terms of our getting good mortality data on this planet today, we have a huge problem, and that is the United Nations. You know, like with the police and whatever your hometown is, it is really near impossible to be a solicitous, kind, gentle partner and be a policing enforcement mechanism at the same time. We saw this with where is the origin of COVID in China and WHO, and we see it again and again and again, especially with mortality data. The most amazing example I can think of is WHO with the MSF think tank Epicentra did a survey in northern Uganda back in 2005. The president of Uganda said, "This is complete crap, it's not true, this is wrong." And WHO instantly made public releases saying, "Oh, we've got some major errors in the study, we have to redo it," without ever telling anyone, including the authors, what the major errors were. Here we are 20 years later, it's never been redone. And this process of not being able to stand up to a government and helping them actually cover over, as Debbie talked about, has happened in Darfur, in Iraq. It's happening with Uyghurs in China today. It's happened in many, many, many settings. As Barry mentioned, most of my work in recent years has been in the Central African Republic. MSF intended to do a nationwide survey in CAR back in 2020, and it was disrupted by COVID. And the first part of the study was done, then it was dropped, and the government of CAR brought in thousands of Russian mercenaries during COVID because almost all the expatriates and witnesses disappeared from the rural areas. And then in 2002, when COVID had sort of passed and we were getting ready to do it again, MSF sort of looked at the situation. These Wagner mercenaries had been inconceivably violent and brutal, and they decided it's just too dangerous, we just can't do it. Here are all the mortality estimates I can find in the Central African Republic over the last 12, 13 years or so. Notice 3 of them are nationwide mortality surveys done by the United Nations. All of them are higher than this top line, which shows the official UN estimated death rate, an under 5 death rate. And in fact, all of them by one, but one, are more than twice as high, including all the national estimates. And so MSF backs out, and it turns out that a local Congolese NGO kind of took their protocol and questionnaire, stepped up. As you look at this picture, there was a doctoral student from Johns Hopkins who had worked with this Congolese NGO as an intern when she was a master's student 10 years before, and she came out and volunteered, and I came out and sort of gave them statistical happy help. And they went out and they did an incredibly boring mortality survey, exactly like the Sphere Project would recommend. It was 2 strata, 40 clusters in each side, probability proportional to size. The recall period was the year 2002. And they measured the highest mortality any country measure has found in a couple of decades. And the violence was way higher in the areas the government didn't control, as was talked about by some of the early presentations. The main cause of death were malaria and diarrhea, but violence was only 6% of the deaths, but violence really caused most of the disruption. And you know, these Wagner mercenaries were only weakly associated with higher cluster death rates if they had been living or fighting there. But the stories that women told about they attempted to rape every woman in our village or whatnot were just really, really stunning. And it isn't just a situation where in the last couple of years, where things have been bad for decades and decades. You know, something has changed in the last couple of years. So did MSF do the right thing in backing out? I think so. Like, they provide more clinical services every day than does the Ministry of Health. If they pissed off Wagner, pissed off the government, and were kicked out of the country, there are thousands of people on antiretrovirals or in the middle of their tuberculosis treatment who would get dropped. I don't want MSF kicked out of here. They're way too important. And a lot of NGOs are coming to this place where they're deciding, no, we just can't do politically hypercharged things like measure mortality. When I brought this original idea 4 years ago to IRC, they said, no way, we're not touching it. Can WHO do this? Well, I'm skeptical. Well, then, you know, who's going to do this? And I think the model you just saw of a local organization utilizing the skills of Northern universities is actually what we're going to need to solve this in the future. Okay, well, I'm going to stop there and look forward to the discussion. Thank you.
Yeah. Thank you very much, Les. And we will indeed come back to that in just a few moments. Our last speaker is Len Rubenstein. He has worked for many years in health and human rights. He's a professor of the practice in the Department of Epidemiology at the Bloomberg School of Public Health at Johns Hopkins University. And he is interim director of its Center for Public Health and Human Rights. Len spent many years as president of Physicians for Human Rights. He founded and chaired the Safeguarding Health and Conflict Coalition, and he's the author of the book Perilous Medicine: The Struggle to Protect Healthcare from the Violence of War. Len?
Thanks, Barry. And I have to say that it's difficult to follow 5 of the world's leading experts on today's topic, who have taught me so much over many years. It kind of reminds me of this story that when Teddy Kennedy was alive and a senator, and he spoke on the last day of a 4-day conference, and he said, you know, everything that's needed to be said has been said, but not everybody's had a chance to say it. So I hope that I'll be able to say something that hasn't been said. We've talked so much about the role of universities with respect to humanitarian training and practice. But I think Les's talk to me, is a transition, because there are other roles for the university that I'd like to talk about briefly. One is research. Another is teaching not about humanitarian practice, but teaching about war. And the third and most overlooked is the role of universities in solidarity and advocacy. So I'll touch on each of these. I think that we have to recognize, with respect to the first issue of research, that the field isn't just about humanitarian work, but that's where the money is, and that's where the research is. There's very little funding and very little interest in looking at some fundamental problems, like what are the drivers of war? What are the impacts of war? How is health affected by war? How can we get accountability for perpetrators of atrocities? These are not simple issues, and they're of enormous importance. And yet, if you look at university work, they're not on the agenda. And I'll just give you one example. I work on violence against healthcare and conflict, and you would think that subject would be of interest to an academic academic researchers. I mean, it's about healthcare, it's about public health. So we did a systematic review of the peer-reviewed literature over the course of 37 years, from 1983 to 2020. In those 37 years, there was a total of 40 peer-reviewed articles in the literature. 40. That's one a year. In most other fields, you have 40 in a week or a month. But here, there was no research, and it's been left to NGOs like MSF and Physicians for Human Rights and environmental groups and NGOs in Myanmar and Israel and Syria and elsewhere to do other work, to do high quality research. And it's that research often is not in the peer-reviewed literature because they issue reports and can't be bothered and have the urgency of getting reports out and not waiting for a long process. But this is also an opportunity, because there's such a need for this research to understand conflict and drivers of conflict, and impacts of conflict. And that's where I think it's a completely overlooked area. And while the funding is hard to get, the typical donors like NIH do not fund this kind of work. But if you really want to do it and you want to work with partners like Les has done, you can find a way to do it. The second thing I'd like to mention is teaching. As late as 2012, a decade ago, only 2% of public health courses in the United States covered anything much about war or had war as a major focus. The Council on Public Health Competencies, which accredits every public health school in the United States, has nothing about knowledge about anything about war, even today, but led mostly by universities in Africa and to a lesser extent Europe. There is more teaching about war and public health on the issues that I just mentioned, and as Barry mentioned at the very beginning, not only research on war itself, but on the roles public health professionals can play in addressing war and stopping war. And our colleague, Amy Hakopian, who couldn't be with us today, has been particularly innovative in developing courses at the University of Washington on these issues. And when you look at her learning objectives, there are like 12 different learning objectives in that course. And that just shows how complex the issues are, from the drivers of war, to the nature of war, to the politics of militarism and public health, on spending on in war, on early warning, which we talked about before, and other dimensions of war. And she recruits people to teach this course and does remarkable things. The last class in her course every year is to have a mock hearing before the U.S. Armed Services Committee, and the member of Congress for representing that area in Seattle comes to the class and holds a hearing. So there are ways of really doing creative and innovative things with respect to teaching. So let me turn to the third issue, solidarity and advocacy. Jennifer properly mentioned the squeamishness of universities about sticking their neck out on anything remotely political. But I think we've seen that there is much more political space for doing that, and it's beginning to happen. You don't think of a university taking a position on a war. That's a primary case of something that is untouchable as too political. But at Johns Hopkins, our dean wrote a letter condemning Russian aggression in starting the war in Ukraine. And that led in turn to the American Society of Schools and Programs in Public Health, which is all the deans of all the public health schools issuing a similar letter. And I think that shows that we're starting to chip away at the myth that university neutrality and distance as scholars means that they have to and will ignore the horrors of war. Last mentioned the terrible problem of the world is inequity. It is, of course, that's true. You could also choose climate change. You could choose war, as Barry said. A staggering number of people in the world live in war zones. So there are now emerging coalitions and groups that are trying to bring together academics and people from the NGO world to address issues in war. There's a new global alliance on war, conflict of health, which is trying to take a broad disciplinary approach to war, to share ideas about how to research and act with respect to war, and basically to bring together like-minded people who have been toiling kind of on their own in very isolated situations where they're not rewarded for what they do academically, and they don't have anybody to talk to. Another example is the Safeguarding Health and Conflict Coalition, which is, as you could imagine, it has its mission to protect healthcare in war through advocacy. It has 5 academic members, one of whom is this consortium, the Consortium of Universities in Global Health. And that's a tribute to CUGH that it joined and is willing to take advocacy positions, which for some people seem uncomfortable or even unethical in some way. Other universities, including the Harvard Humanitarian Initiative, Human Rights Center at Berkeley, and one at Hopkins, are all part of this effort, and it shows what can be done. But there's got to be more than that kind of organizing. Solidarity means really supporting our colleagues, and that's another problem Jennifer mentioned about universities. There are doctors, 400 plus doctors in Myanmar who've been arrested. Probably over 1,000 Syrian doctors were arrested in the war. In Ukraine, doctors have had to practice clinically in basements, dank basements, deliver baby under terrible situations, and they ought to have solidarity. Doesn't necessarily mean that you have to send medical supplies or much less go there. But just the idea of support is very important. I remember speaking to a Syrian doctor who said, you know, we're getting attacked every day and no one is paying attention. When you're in that situation and you know someone is paying attention, it makes a difference. And then there are concrete things you can do. At Johns Hopkins, faculty got together and persuaded the school back in the early days of the Syrian conflict to establish a scholarship for Syrian health worker to come, a full scholarship to the School of Public Health. And that program has been going on now for a number of years, and it's expanded beyond Syria. And these are not famous people. These are people who have encountered public health after being clinicians and they knew nothing about public health, but the war made them understand how critical public health is if you're going to deal with the impacts of the war. And so they're coming for training. And needless to say, issues around visas. In fact, this year, one of the students who was selected was not able to come because the US visa didn't come in time. But those obstacles could be overcome. And I think what this shows is that universities just have to come out of their cocoon. And there's so many opportunities to address the realities of war, not only through a humanitarian lens, but through a much broader lens, because the opportunities for helping are enormous. I'll stop there and we'll continue.
Thank you very much, Len. I want to give Stephanie and Les an opportunity to comment on what you presented, and then we'll open up for a broader discussion. Stephanie, do you want to make any further comments?
Thank you, Barry. Well, I agree with what Len was saying. I think universities really shouldn't be afraid to take a stance on this and stand up for what we know is right with regard to war, disasters, and humanitarian issues. Also, I think, that universities in a way really miss a golden opportunity if they are not engaged really actively in these topics and supporting at least a discussion around them, because the students certainly are. I can tell you that both at the graduate level and at the undergraduate level, students are paying attention to what's going on in the world. They are engaged. They certainly have opinions. And it really is up to the university to allow a more complex discussion about these things to take place. So I think that if they are willing to engage in, the current events of the day, just like they engage on, Black Lives Matter or diversity issues or any of the other issues of the day, they will find that it makes the university life and the student engagement that much richer.
Thank you. Les, do you want to comment further?
Yeah, I can't agree with Len on most of these issues enough. Thought number one is like, okay, well, what are you going to do in your university that can make it a little bit better? There are several tools or models out there, and my favorite one is the Karolinska Institute, who just works with a few countries. They take a lot of students from those countries. Their doctoral students from within Sweden go and do their dissertations out in those countries, and it creates these incredible bonds over decades that lead to wonderful things. Tulane University actually did something like this in Congo, in the public health school in Kinshasa. They got 2 5-year grants from USAID, and they sent 2 to 4 faculty per year to the public health school for that decade. And they brought back about 20 Congolese students to get doctorates at Tulane most of whom are still working in Congo, in Kinshasa. And it is astonishing how functional and competent that public health school is in Kinshasa, in a country where almost nothing works. And here we are, whatever, 35 years later. And then the final thought is that, you know, I worked at a university that, like yours, is incredibly prostitutional and money oriented, has all sorts of shameless rules, like you can't spend most of your grant outside of New York and that sort of thing. And there are tools that older, smarter people than me taught me early on to transcend this, like make sure you include a USAID rate of per diem, which when I got my first CDC grant, it never occurred to me to do that, because who needs $80 a day to eat in Congo? And it would allow me to do things like buy a motorcycle from my local partners when I got there using my per diem money, and a whole host of other things, or stay in the upstairs of their office, and my graduate students stay in the upstairs of their office. We pay them for the room, and they've got at the end of time a couple $1,000s of unrestricted money, which for a local Congolese NGO just makes a huge difference. So there are tools we can develop within the constraints we live in that allow us to create these nurturant, loving partnerships that are needed to transcend the barriers. Thank you.
Yeah. Len, do you want to comment further?
No, I just agree with with Les entirely. You know, we're in agreement on this totally.
I want to give Jennifer and Ella an opportunity to comment on what we've been talking about in the second half of the satellite session. Jennifer, do you have anything you'd like to add?
Ella, please join if you can. I agree with everything that's been said. I think it's very important. I'm fully on board. And when I started teaching, the course was on war and public health, and it was a seminar at the Harvard Center for Population and Development Studies that had a benign and supportive and worldly leadership. There was no money, but it was a very good space, and students came from across the university to take it because it was the only course then on war and public health, complex emergencies. We had different words for it, but and so I think the student interest is remarkable. As Stephanie said, it's only grown, and I'm sure this is true of universities around the country and elsewhere, I imagine. So for the universities not to realize that this is entering a global world that is fraught with anger and mistrust and misery. And the North, the global North, has a great deal to account for. And not to think that there are modes and arrangements that can begin to create a discussion and a mode of action in support of people who are caught up in conflict and disaster that is much more bilateral than even the one we're having here, right? I mean, we're talking about how we want to reach out, and there's some very good examples that have been successful, but it should be much more of a global movement of universities to say what is going on here. All of us in this webinar, as well as those of us who are speaking, know that we don't have very much time before the world ceases to be one that all of us here understand, give or take, 40-year age differences. I mean, it's short. And it's going to take collective action at various levels, of course. But we in schools of public health have very good connections with colleagues overseas, with former students overseas, with branches of government overseas, branches of civil society overseas. And it would be, I'm not going to try to craft it on the heels of the very good words that everyone here has said, but I believe there has to be an animus that is a positive animus, a spirit of productive, intensive collaboration around these high moments of jeopardy that are not actually moments. We have high zones of jeopardy that are only going to get worse. And I'm not feeling apocalyptic. I'm feeling somewhat desperately hopeful, because if we don't mobilize, it's going to run away from us. It may already have. And there's a comment in the chat from a good friend of mine, Lynn Jones, who is a phenomenal humanitarian, psychiatrist. She's done enormously good work in a wide range of conflicts. I engaged with her in Kosovo years ago. And she's writing, well, if the global north is going to do all of this, anything that is positive, how are we going to deal with the north-south divide in terms of who is doing what to whom? How do we mobilize colleagues in the figurative, imaginative global south, because it's not just south, obviously, who have had so much done to them by so many of us, to be blunt. How can we mobilize in a way that stirs very deeply, so that the community of action is much more heterogeneous from the standpoint of where you stand and what your grievances are about and who's responsible for what. And to me, that is also something that a consortium of universities particularly in global health, who work on around the world. Because a number of you have been touching on all the universities and the partnerships and the very good skill sets that are prevalent throughout what we might call the global south. Good colleagues I'm working with in Bangladesh around climate change. There's enormous talent. So this is just a visionary thought I have based on what you all have just been talking about.
Yeah. Thank you, Jennifer. Ella, do you want to comment?
I almost hate to. That was very inspiring, Jennifer. I think a couple of things. One is earlier in the discussions, when raised the question of early warning systems, and the reality is an early warning system doesn't work unless the people in place know what they're looking for. And the way that you have people who know what they're looking for is by giving them that training, and it's not by training, Americans. We, MSF, often is the first to hear about some sort of infectious disease outbreak in some remote community because somebody in DRC, it's often someone who is trained by one of the colleagues who studied at Tulane, Alice was talking about. Somebody knows, like, hey, this acute watery diarrhea situation is serious. People are dying. This isn't a normal thing. We need to sound the alarm. And they have the tools to respond to a cholera outbreak quickly while they sound that alarm. And so thinking through, how do you build those systems in place? How do you make sure the people who are actually the people living there on the ground know what to look for, and how to mobilize resources in an appropriate way, and know that when they sound the alarm, someone's going to respond. Like, those are the big elements. And I get a little bit tired of the early warning system conversation, because it's sort of these very basic level things that just are never going to be in place unless we really follow through on those commitments. I think there's such an opportunity to build partnerships with African universities in particular. I think deans of universities should go to these countries and realize it's not as dangerous as it seems in their head, because often when professors reach out to us for collaboration ends very early because they realize, oh, my university is never going to let students go to those places. And we're not proposing to send students to intense war zones. Like, we're not crazy. That wouldn't help anyone. Talking about very stable countries and contexts, talking about university students being sent home from Ghana when there was Ebola in Sierra Leone. I mean, levels of risk aversion that make absolutely no sense from a medical or political perspective at all. And I think that's where university administrators need to really reality check themselves on some of these rules. I realize that might not sound like a very convincing argument coming from someone who intentionally goes to war zones, but really, like, not all of the African continent is a dangerous place. It's really okay. My mom even went to Sierra Leone when she was in college. So we are getting more risk adverse, I think, rather than less, and without good reason. And then another thing was this issue of visas. And I mean, I could go on for hours and hours on the visa issues. It is so difficult to get scholars to the United States, people who are lead authors on really critical pieces of research, and we can't get them a visa to come present their work at an academic conference. We can't get visas for staff to come to MSF's annual meeting to talk about the work that they're doing in their home countries. I mean, it's worse than that. I can't get visas for people to transit through the United States in order to respond to the Haiti, to cholera in Haiti last year. We were fighting with the State Department over that. And, you know, who speaks French and has experience in cholera? Well, it's going to be a lot of our colleagues who are working in Africa. And so there's also that side of advocacy. And if universities would step up, not just for resettlement, if anyone wants some Afghans who are not strictly speaking scholars, but could really benefit your university community, let me know. I have a lot of people who would love that opportunity. But also just to really push back on some of the restrictive policies the US has put in place over successive years that just do not make sense, that are real barriers to humanitarian aid and don't benefit the American people in any way, shape, or form.
Yeah, thank you very much, Ella. Les, I see you nodding your head continually. Do you want to comment further?
Can't emphasize that security thing enough, that we're getting so risk adverse. My program on forced migration and health was started in 1998, funded because of the Rwandan genocide and how poorly the American NGO workers had done compared to other groups. And the key thing about it was it had a funded practicum in an emergency setting. And for the last 5 years or so, exactly like Ella said, you know, my dean just goes freaking apoplectic when you want to send someone to peaceful Eastern Congo, far from where there's any conflict. And it just has collapsed because the school's gotten so risk adverse. When I went to West Africa to work for WHO on the Ebola outbreak, I had to resign from Columbia University so that there could be no legal connection between me and the university if 5 months later I wanted to come back. And almost every public health school had the same problem, except Tulane University, who has the words tropical medicine in their name and has a culture that made it so they expect themselves to go out and endure risks and to be in disease-laden settings. And you know, Tulane had dozens and dozens of their faculty show up in West Africa, including working for us at WHO, and no other American university did. So I just can't agree with that more enough. And then secondly, I think we need to be a little bit honest about the university self-interest phenomena. And, you know, if our students understood the median income on the planet is $6,000 a year, if our students understood that if we had a $1 per hour minimum wage on the planet for all goods that cross a border, that essentially that would double the income of the bottom third of the planet. And so we've got this nationality fix that structurally maintains this inequity. And I think universities are that sort of bubble of isolated contemplation who can step back and think about this and say, wow, we need to be dealing with the structural problems, as I think was Debbie started out talking about, that exist out there. And that also, once we've done that, will allow us to put a little pressure on the UN to be a little more risk-taking. As Ella just said, it isn't by chance. Over the last 20 years, MSF has declared famines on the world more often than the United Nations has. Probably most times when famines happened on the planet, The UN didn't declare it because they didn't have a mortality measurement. It is easier to measure mortality than it is to measure malnutrition, which also needs to be measured to declare famine, but it's hyper political. And so the fact that the UN in 2016 in Northern Nigeria, a couple years later in Niger, in 2014 in South Sudan, won't declare famine because they don't have a mortality estimate, like that's the system faulting. And we in academia can fix that with local partners if we are close enough and love them enough. Thank you.
Yeah, thank you very much, Les. I want to shift the conversation a little bit and build in some ways on what Lynn said a little while ago and talk about the potential roles of universities in the prevention of war and the promotion of peace. I mean, one way of looking at these subjects, and I realize it's condensing it down, it may not be fully reflective, but one way of thinking about it is in three areas. One is the role of universities in helping to resolve conflicts before they turn violent. And I'm not necessarily talking about becoming the negotiators and mediators and so forth, but perhaps training, and what universities already do, arguably, training diplomats and others who, from one perspective or another, can diffuse situations so that disputes and conflicts don't turn violent, number one. Number two, addressing the many underlying causes that lead to war, from militarism to socioeconomic disparities to poor governance and so forth. Yes, indeed, universities are doing that in various ways, but perhaps not in a concentrated or coordinated effort. And the third is in building a strong infrastructure for peace. Again, I think the people who are most directly involved in country are the ones who are primarily responsible for building and maintaining a sustainable peace. And indeed, it's been shown that women should have greater roles in doing that. It's the men who more often make war. It's women who have actually been more successful in building sustainable peace. But I think universities have roles to play in all three of these areas: resolving conflicts, addressing the underlying causes, and strengthening the infrastructure of peace. And I'm wondering if any of you would want to comment on that. Jennifer?
Barry, I like what you said. I would either add or modify this point that, and Ella perhaps stated it most strongly, that the foreign policy role of the United States is problematic. And if there are ways for universities to be, and they'd have to be wise college presidents or university presidents, and a consortium of others, faculty with them. But if there were ways in which the concerns that many of us have who work in universities and have been elsewhere to see up front what's going on in a wide range of negative modes, if there was a way we could convey how complex it is for us to be able to support countries in need and for us to train leaders in these countries so that they can actually be in a much more powerful positions and more knowledgeable positions because they're deeply educated, it might make a big difference. I mean, the visa points that Ella was making, and I didn't know you had to resign less to get into an Ebola-stricken area, but it's absurd, isn't it? And it's blocking the sort of dialogue and knowledge translation that we absolutely need to be supporting. So I would like us to think, not just now, but to take that idea of democratizing and rendering much richer the exchange of ideas and permanent locations of knowledge generation in other parts of the world. That to me is now a possibility and probably a really strong responsibility.
Thank you, Jennifer. Further comments? Do universities have any role to play on the prevention of war and the promotion of peace?
You're
Len, do you want to go?
You're
Yes,
asking
please.
rhetorically. Yeah, no, Len's a good person to answer that.
I think we are kind of conflating sometimes universities and people who are academics at universities. We know the problems with universities. I'm actually very fortunate. There was a picture that Les showed of his Congo group, including one of our graduate students, current graduate student. She's in Chad now. But my school doesn't stop you going to conflict zones. Only COVID prevented people from traveling in terms of a rule. But going back to the question of what academics can do, there are some very simple things. Les mentioned a number of times problems with WHO, and its record on issues of war is terrible. It's terrible mostly because what it does is pablum, and it doesn't want to antagonize any of its member states. And if you're talking about war, it's very hard to address war without calling governments that are perpetrators of atrocities out, and it won't do that. But there are things academics can do to go to their own governments and ask them to speak out more on these issues. Now, some governments won't, but some don't do it because they don't know they should do it. And it could be an important role to go to them, maybe go in partnership with NGOs and civil society groups and say, look, this is an important issue at the global organization for public health, and it's not doing its job, and you're a member of this organization. Would you please speak out and use whatever leverage you have to put pressure on the WHO to do a better job? I can't think of any other areas, I may not know, in public health where it is so deeply abdicated its responsibility.
Thank you, Lynn. Stephanie, did you want to comment on this or not? Stephanie, you're muted.
Oh, I'm so sorry. Everyone froze for me for a moment there, and I think I missed what you said, but I saw that Les briefly had his hand up.
Okay, no, I just want to give you, Stephanie, an opportunity to comment on what we're talking about, especially the role of universities in the prevention of war and the promotion of peace. I'm not sure if you want to comment on that.
Thank you. I would like to pick up on one thing that was said, which is the point that Len made, that universities and the professors of those universities are two different things. I think we have to remember that university tenure exists so that people can be outspoken on certain views that they feel are backed by the evidence. And that is the job of tenured professors at universities. And so I think even in those times when the university itself doesn't feel that it can take a certain stance, whatever the reason, I think it should be supportive of and encourage its tenured faculty to do that, because that is the point of tenure. And I think I have seen over the years, the courage, is that the right word, of certain senior tenured faculty not always be what I wish it was. And I think to myself, what are you afraid of? This is what tenure is for. Now, to be honest, I think some of what they're afraid of is a social media reaction, for example, because people have been absolutely skewered for certain things. And that's the real threat in the world we live in. But at the same time, as much as universities exist to help us think through things, gather research data, improve the evidence, share teachings, university professors also exist to take a stand. And so I think I would like to see more of that. And when they do, I would like to see that those universities back their professors, if only by saying they're tenured, this is what tenure is for, free speech, And let's protect their ability to do what university professors should do in the realm of advocacy.
Yeah, well said. Thank you. Les, please.
Yeah, I also raised my hand for the same reason as Stephanie. I like Len's comment about the university and the professor aren't exactly the same thing. And I'm not sure everyone knows this, but a fellow at Johns Hopkins named Bob Lawrence got together with his dean at the time, Mike Clegg, and he was very, very upset because it turns out the CIA had hired a doctor in Pakistan in the hunt for Osama bin Laden. And they went out and they did a sham hepatitis vaccination campaign. And instead of just giving people vaccine, they went to houses where they suspected there might be Saudis hiding, and they sucked a little blood out of the child in order to see if they could find any Saudi DNA, and then go back and kill the parents of that child. And it didn't work, but this is what they did. And when it came out and that person was put on trial, it led to the killing of a lot of vaccination workers in Pakistan, the collapse of the polio eradication program. And Bob Lawrence organized for the 12 sort of deans of highest rank in the American schools of public health to write a letter to President Obama saying the use of vaccination programs completely undermines what our students are trying to do to help the world, undermines public health. This is never justified. It's despicable. And to their credit, a year later, President Obama's White House wrote back and said, "You are right. We have ordered the CIA never to touch or use vaccination programs again." So there are things that the universities can do. And what's really great is when we, on those rare occasions, get our deans to do something great like that, it sort of moves them a little closer to being the global players we want them to be. So I think there's room for both, and we are unique interlocutors at prompting both. Thank you.
Yeah. One of the things we haven't talked about, and it's part of the title for this satellite session, is the impact of war on the environment. I know we touched on sort of, I did in my opening remarks briefly, and one of you commented on climate change and how, in a sense, everything is connected to everything else. It could be argued that there's a bidirectional relationship between climate change and war. Climate change can cause conditions that may lead to war, most notably desertification and forcing people to migrate and so forth. But also the extensive use of fossil fuels during war and the preparation for war is a major contributor to climate change. I'm just wondering if anyone wants to comment further on the issue of whether the universities have some role in protecting and protecting the environment, but also preventing the environmental impacts of war. I recognize also that when there are people dying, and there's a humanitarian crisis, the focus needs to be on that, and not necessarily thinking about the environment. But the environment, of course, in many ways supports people in their health and well-being, and so it's another area that I would say is important for universities to consider to document the impact on the environment, particularly the ways in which damage to the environment in turn impacts on human health and well-being.
Well, I believe there's ample opportunity, and it certainly has not been taken up. The post-war environment is one, and post is in quotes, but there is a time when the kinetic nature of war begins to abate, and people can travel and with care walk the land. And there's all sorts of satellite reconnaissance one can do as well. The wars, as we all know, deeply damage the environment, and they make returning people, or the people who are forced to be in place, face very real difficulties in returning to normal life, agriculture, building a house, trying to find a clean water source in contaminated land. The war in Syria was particularly grievous in its in the intense bombardment, the use of firebombing and barrels, and the obliteration. This is all from aerial attack. The obliteration of massive amounts of historic treasures and monuments that, and then permitting looting of the ones that were left or before they got bombed. I mean, there's this is happening in many places, and we're seeing it happen in Ukraine in a different scale and a different environment. It would seem to me, and I'm in line with this, that there should be courses on the environmental consequences of war. I participated in a few seminars, et cetera, but this linked with climate change will focus the mind in terms of how much of what is happening now is almost irremediable. It will take decades to clear Ukraine now of the detritus of war. And the fields and even the climate of Ukraine may well make it difficult to have the same kind of agriculture and the same use of land that it has before the war. But we're not going to see this because people aren't going to be able to use the land because of the war. This is true in Syria, and it's less obvious because Syria is frozen in time because of the government. And so it is very difficult to hear the laments of people who are trying to grow a crop or build a house or move across an urban area because it's also quite destroyed. And this is true for many of these wars. And I would say there are so many skills and areas of expertise that universities have: geographers, environmentalists, satellite reconnaissance, museum experts, archaeologists that could be brought into a post-conflict or peri-conflict zone to help the world understand what's going on and to marshal the resources to help to rebuild. I know that this is after the fact, particularly with these intense wars. You can't go back in time, but as part of energizing consciousness about war and its destructive aspects, I think it would be a very interesting discussion at the universities about what one needs. I mean, it needs to be what needs to be done and what one could be doing. And I've been in touch with a number of different people as it comes to Syria and less so Ukraine, but some of you may have been. And I believe that there's a real interest among the technical faculty in the fields that I just talked about in how they could be helpful.
Thank you, Jennifer. Any further comments? We're beginning to near the end of our satellite session, and I want to give each of you an opportunity to make some final comments, particularly with an eye towards, once again, what is the role of universities? What should universities start doing or start doing better? What specific recommendations we may have along those lines to address universities in addressing the impacts of war on health, human rights, and the environment. Ella, I'm going to give you an opportunity to speak first if you'd like.
Sure. I mean, thinking back through this conversation, it's very interesting, especially to be the non-academic on the panel and to be looking at this only from the practitioner side. So I feel a little bit guilty, to be honest, to say like, hey, universities, this is like my laundry list of things I think you should do. But nevertheless, I'll do that. So I think going back through really helping to find that balance between where Debbie started us with this tension between the theory and the practical aspects of the work, encouraging students to find ways to get practical experience. I think the comment about the perpetual insecurity that communities in the United States and other wealthy countries face is actually a really good place for students to start to gain some of those practical experiences and to be very blunt, fall on their face and pick themselves up and figure out a better way to do it. I think the other thing that we haven't talked about, but I think is really important in universities, is fostering an environment where failure is allowed and where people are encouraged to learn from that failure. A lot of the critiques that we can levy towards the UN agencies in particular is that they are just fundamentally, and I've worked for WHO, and this was my biggest problem working there, they're fundamentally unwilling to say when something's not working. They're afraid that they will lose their reputation. They're afraid they'll lose their funding. We have to move beyond that. And the thing that keeps me at MSF, I guarantee, is not the salaries, but rather the fact that we, the UN I would stay there for the salaries if I could overlook the fact that we're not allowed to say failure. But no, in MSF, you're actually allowed to turn around and say, wow, I tried this thing and it didn't work at all. And the response is, well, what do you think will work? And there's this environment of constantly learning. There's an environment of really understanding that the shame isn't in the fact that your program or your approach didn't work. The shame is in continuing to do something when you know it doesn't work. That's what's shameful. And so if you can, at the university level, already set students up to say, hey, this thing that I thought was such a great idea doesn't actually work. How can I improve upon it? How can I change course and meet the needs of this population? That would be a huge benefit to, I think, the entire humanitarian sector.
Yeah, thank you very much, Ella. Stephanie, would you like to go next? Any final comments?
Yes, thank you. I just have two things to add. The first, in drawing on what Ella said, the first thing I'd like to see is more encouragement from most universities in encouraging undergraduates to go into more humanities-based fields of study. I think we've seen a huge trend toward people studying STEM degrees. And I say this as a doctor myself and as a person who really values science and technology and numbers and statistics and learning how to work with all of those things. And at the same time, I think the lack of a broader, more general education in the humanities has taken away from the human skills and the perspective gaining that people who work in global health and in humanitarian work and in war and conflict need in order to do the right kind of job with the skills that they develop. And so I think that's the first thing. The second thing that I would say is I would love to see universities be more open to valuing the practical experience of some of our potential instructors from the Global South who do not have the fancy Global North degrees and PhDs that we have. I think my students, especially in the undergraduate course, have so enjoyed working with people who have been right from the field. And it's not only inspiring, but it's really eye-opening in a way that other guest speakers and courses could not produce. So those are the two things that I think I would leave us with.
Great, thank you. Les, would you like to make some final comments?
My main comment is those last two comments were so beautiful, I don't dare speak. Thank you.
Thank you, and thanks for your earlier comments. Len? I think you're muted.
Can't believe after 3 years. I think one of the things this conversation has shown quite directly is that both universities, quasi-universities, and faculty have done too little, almost nothing, to address one of the great public health problems of the world, which is conflict. On the other hand, despite obstacles, including risk aversion and many other obstacles, it's possible to do a lot. And all it takes is a willingness to do it. And if you do it, you'll get a lot of support. There's increasing support from colleagues around the world and around the country to engage. So I would just encourage people to get involved.
Thank you, Len. Yes, please, Les.
Actually, there's one thing I forgot to say, and that is, it hasn't been mentioned, but oh my gosh, have I worked with unbelievably idealistic local partners. And to be a tool of them to help them measure how bad things are in CAR, like, oh, that is the joy of my life. And there's something magical to be gained in a selfish sense. Thank you.
Yeah, thank you. Well said. Jennifer?
No, I completely agree with what's been said. And I want to thank you for doing a really good job of keeping us in line and engaging in a conversation. Delighted. I like the flow of this conversation very much. Thank you.
Yeah. Thank you all for your extraordinary presentations and enlightening discussion. This has been a wonderful satellite session. I hope we can talk further and engage others in this conversation going forward. In conclusion, I also want to thank Steve Pargarten again in the Office of Global Health at the Medical College of Wisconsin for their support. I'd like to thank Jenna Smith for her assistance, and once again, Keith Martin for his extraordinary encouragement and support for these efforts. Thank you all, and look forward to moving forward with these issues. Take care. Bye now.
Bye.
Thanks, Barry. Thanks, everyone.
Thank you,
Thank you
Barry.
all.